The question is...
Oh, Mr. Speaker.
Simon O'Connor. I thought we were going to have a very short debate.
It could have been, you never know. Go and get a healthy check. There's a great phrase, the timeo danios et doneferentes. I'm not quite sure what the declension is in terms of the New Zealand First Party, but beware Greeks bearing gifts. And we've just heard from the other side that this is a no-brainer, it will save money, it's easy. Well, look, the National Party's position is quite clear. As is my own, we will not be supporting this bill, and there's a number of good reasons to do so. But as we start around this bill, there's always that usual suggestion, look, let's just take it through first reading, let's just put it to select committee and have a discussion. I'm certainly one of the people who doesn't necessarily believe in just sending things to select committee for the sake of it. I think we can exercise some judgment prudently and early on, Mr. Speaker, in order to engage with this particular first reading of the SuperGold card health check bill. Look, any attempt to try and improve the health of Kiwis is worth engaging, is worth discussing. But just because, and they're yelling, we have to go to a select committee, they sort of forget that we have a pre-discussions before we come to anything like this, and that we actually have a debate at first reading to decide whether it's worthy of going forward. And as I said at the start, there isn't really much need for this to go forward. Look, the primary reason, and those who understand health will understand this, that it's all ultimately about targeting and putting money and support into the most necessary places. Those of us engaged in the healthcare, be it as the chair of the committee or in my work previously, there isn't unlimited cash for every desire out there, and we have to make our priorities. We have to take our priorities there. We also got to take some. We've also got to take some prudency around some of the arguments. One that the right honourable gentleman put forward is that people are getting older, and therefore as ages increase, we have to make sure people don't go to GPs and go to hospital. It doesn't really make a lot of sense, because actually as people are ageing, it doesn't really matter when they engage with the GP. They will still ultimately, for a lot of people, end up in hospital or in residential care and the like. So it's not ultimately a saving further down the track. But what we see is the main provisions of this bill. The save of this bill. I have to say, one thing I'm noticing is the opposition, they're in excellent voice and won't need to go and see any ENT or anything there. I'm sure that through your vocal cord exercises here, you're doing very, very well. Look, the SuperGold card is arguing with this particular bill that there are 3 free visits. Mr. Speaker, what we know already is that, generally speaking, those over 65 are not struggling to go to the GPs, not certainly in the same way that our younger people are. What we know already is that 95%, Mr. Speaker, 95% of those over 65 are able to get to a GP at least once a year. Of course, they're not terribly happy to hear that stat, so we should repeat it again. We wouldn't want them to be hard of hearing. If, of course, the opposition are hard of hearing, I'm pleased to tell them that the SuperGold card, enhanced by the National Party, enables you to go to the likes of audiologists to help. Maybe you could recommend it. If they also need some ophthalmological help, I think the enhanced SuperGold card by the National Party, you can get some ophthalmological help as well. I'm not sure they do brain transplants, that's probably a bit too involved. But look, the stats are very clear. 95% of those over 65 years of age are able and are accessing a GP. In fact, 80% of those over 65 years of age, Mr. Speaker, access a GP 3 times a year. So really you've got to ask what the problem is here. I know in my own electorate, and look, it's relatively diverse, you go from the heights of Oraki down to the likes of Glen Innes. This is not something, and probably not being a constituent MP, the honourable member wouldn't understand this. Well, sorry, he's just become one. Look, he's just become one. That's right. He's just become one. So I'm sure he's going to tell me. He's going to tell me that he's had the member's going to tell me there's all these people knocking his door down. Well, actually, I know from my own electorate, this is not an issue, be it from Glen Innes or from Oraki. They're not demanding this. In fact, what they're asking is more focus on young people. Of course, they might talk about Northland, seeing that my family's from up their way. This is not something they talk about. In fact, they're asking where the local MP is. But look, the government already has a wide range of support. Still looking for him, that's right. what they're looking for is obviously support for the elderly. And I think it's important to tell the House there's already something called the Very Low Cost Access Scheme. That's around co-payments which people make, and I know colleagues of mine will speak to that. We already have the high user health card and community services card. Again, those who are most in need, regardless of age, have access to this. And then there's the pharmacy subsidy card, actually quite well used in my electorate. Which is ultimately, if you have over 20 prescription items, that's about $100, basically then becomes free after that. So I think the two primary messages I'm trying to put across here is, first and foremost, our elderly, those over 65, are already accessing primary care, and those who are struggling, there are a multiple array of support services already in place. Look, I think also it's very helpful to note the government continues to be committed to the area of health. You would have heard it during the budget speeches around the extra elective surgeries, that we're having a 47% increase there. Look, we've recently announced that it's $47 million increase into dementia care. I know this is only a small part of it around healthcare for the aged, but we understand the importance of that. We're also working on other technologies to make, say, getting your pharmaceutical scripts easier through the e-prescription service. Something really simple, but actually when our aged or as anyone goes to their GP, it's straight to the pharmacist. They're not having to take a piece of paper. It's automatically being checked. Better for the pharmacist, better for the doctor, and most importantly, better for the patient. So look, ultimately this bill does not need to occur. The services are already being provided to the over 65s. I would suggest this is the classic case of bribing people with their own money. I noticed the honourable member talked about the high taxes in times past. If I recall correctly, that member was in those governments that had those very high. In fact, I think you may have been in a government, Right Honourable Winston Peters, with my predecessor, Muldoon, when they were having the high taxes and so forth. They are already, therefore, those retiring receiving good support, be it through superannuation, through governmental supports already for healthcare, and importantly, through the SuperGold card. It's one of the things I'm sure the Right Honourable Member will be absolutely thrilled about this, that often when I go into the retirement villages and residential cares in my electorate, they'll often mention the SuperGold card. And they're very, very pleased about the Honourable Winston Peters, that he introduced it. And which is great. It's always a positive way to start the conversation. What is excellent is by the time I finish chatting with them, they're thanking the National Party for turning the SuperGold card into something absolutely fantastic. So I think it is important to acknowledge the Honourable Member for starting the journey, the first step on the ladder. National proudly has taken a lot further, and we pay substantial monies now, and rightly so, into the SuperGold card, which is helping across a whole wide array of areas. So fundamentally, this desire to just extend it for this particular reason is really just political, posturing, if you will. As we said at the start, this is not something that's well needed. The member himself costed this at about $69 million. I was going to say it's something between $64 and $100 million a year. Is that really the costings that we need? Again, I don't think we do. We have to be prudent with the health spend. It's the largest ever, just shy of $16 billion now under this government. But every dollar counts. In fact, we heard that very clearly today from the Minister in estimates. We have to be prudent with every dollar. And so targeting up to $100 million to those over 65 to go to the GPs when they're already going to their GPs or they're in residential care and villages, accessing primary health care is not a prudent spend, particularly when you contrast it to what every medical professional will tell you, GP or specialist, that where we need to target is actually our young people. The Health Committee before me, Mr Chair, did a fantastic piece of work before preconception to 3 years of old. That is where the most efficacious use of our healthcare spending is and where we need to focus. It's one of the reasons we, as a government, were happy to have free healthcare under 6 and why most recently we're moving towards under 13. That's where the efficacious spend is, not only in better health outcomes, but importantly, they are the ones not engaging with primary healthcare in the way that they should. So, Mr Speaker, I want to conclude by again reiterating the National Party's desire not to vote for this bill. We acknowledge the great intention of the member in bringing this here for political reasons or otherwise. But look, sometimes a SuperGold card can help you get cheaper tyres, hearing and so forth, but a SuperGold card can not prevent someone coming up with ideas that were a bit shoddy.
Well done.